Welcome to episode 364, where I'm talking about the imbalances which can occur in the reproductive channels, which are Artava Vaha Srotas for women, and for men, it's the Shukra Vaha Srotas. I discuss the signs of aggravation, the disorders which can manifest, and the possible causes. So please stay tuned. Hi there, I'm your host Colette, and on this podcast I will be sharing the teachings of Ayurveda, yoga, and holistic health practices. Now, if you're new to Ayurveda, I recommend checking out the first couple of episodes where I do an introduction to Ayurveda and the mind-body types. Thanks for listening, and now here's a new episode. This episode is sponsored by Kerala Ayurveda. Whether you're new to the wellness space or an advanced practitioner seeing patients, Kerala Ayurveda Academy offers specialized Ayurvedic courses to meet you where you are. A few of their most popular courses include holistic Ayurvedic coach and counselor programs, Vedic astrology, a pulse diagnosis workshop, and many more. Kerala Ayurveda Academy's courses are offered online and in person in the beautiful Bay Area, California, and cater to all levels. Use the code ELEMENTS100, that's ELEMENTS100, for $100 off tuition for their full certification programs. Discover more about their offerings at keralaayurveda.us/courses, and I'll put all that info in the show notes. Welcome back to the Elements of Ayurveda podcast. It's Colette for a solo episode today where I'm talking about the imbalances and disorders which can occur in the male and female reproductive channels. Artava Vaha Srotas is the channel carrying nutrients for the female reproductive tissue, the ova or eggs, and Shukra Vaha Srotas is the channel carrying nutrition for the male reproductive tissue, the sperm. The root of Artava Vaha Srotas is the ovaries and the areola of the nipples. The marga or passage includes the fallopian tubes, the uterus, cervical canal, and the yoni or birth canal. The mukha or opening of Artava Vaha Srotas are the labia. And then the root of Shukra Vaha Srotas is the testicles and the nipples. The marga or passage is the male reproductive organs, including the prostate, urethra, and urogenital tract. And the mukha or opening is the urethral opening. Now, if you want to know more about the functioning of Shukra and Artava Vaha Srotas and the subdoshas involved, check out episode 292, because in this episode, I'm going to delve deeper into the imbalances and disorders which can manifest in these channels. I'm going to start with some of the signs and symptoms of aggravation of Artava Vaha Srotas, such as PMS or premenstrual syndrome, like tender, swollen breasts, cramping, acne, and mood changes. Hypomenorrhea, which refers to light or scanty flow in your cycle, when menstrual bleeding lasts for 2 days or less. Oligomenorrhea, which is irregular menstrual cycle. And metorrhagia, which is bleeding at irregular intervals outside of your expected cycle. Other possible signs and symptoms could be fibrocystic changes in the breasts, cystic changes in the ovaries, low libido or painful sex, blocked fallopian tubes, cervical polyps, vaginitis, or abnormal vaginal discharge or vaginal dryness. They are just some of the signs and symptoms of aggravation in this channel. And if these signs and symptoms are not pacified, they can go on and cause further disorders, such as the following menstrual cycle disorders: amenorrhea, which is an absence of the menstrual cycle. And this can be due to an imbalance in vata and kapha doshas. Menorrhagia, which is a heavy menstrual cycle, including prolonged menstruation. And this is usually associated with a pitta and rakta aggravation. And then we have dysmenorrhea, which is where you can experience pain, severe cramps, and spasms during menstruation, which can be associated with a vata imbalance. Another disorder is PCOS, polycystic ovarian syndrome. And PCOS can cause hormonal imbalances, irregular periods, excess androgen levels, and cysts in the ovaries and fertility problems. A kapha aggravation can be the cause of blockages in the reproductive channels, and a pitta aggravation can result in inflammation. Another disorder is endometriosis, which is a condition where the uterus lining spreads and grows outside of the uterus, resulting in severe menstrual pain, heavy bleeding, and it can result in fertility problems. Endometriosis can be a result of imbalances in all three of the doshas. For example, a vata aggravation resulting in abnormal movement of the tissues, a pitta aggravation resulting in inflammation, and a kapha aggravation leading to an accumulation of tissue. Uterine fibroids are non-cancerous growths in the uterus and can result in heavy menstrual bleeding, pelvic pain, frequent urination, and complications during pregnancy. Uterine fibroids can be a result of an aggravation of vata and kapha doshas. Miscarriage is defined as the spontaneous loss of pregnancy before 20 weeks, and an imbalance of the vata and pitta doshas can contribute to miscarriages. And then there's infertility, which is defined as the failure to achieve pregnancy after 12 months or more, and this can be a result of an imbalance in all three doshas. So those were the disorders that can occur in Artava Vaha Srotas. And now let's take a look at the signs and symptoms of aggravation for Shukra Vaha Srotas. There's hormonal acne caused by imbalances in the reproductive tissues. Genital urinary issues, which are disorders involving both the urinary system and the reproductive system, like urinary infections, painful urination, or reproductive issues. Low libido, loss of sexual strength or vitality, including mental and physical depletion. Now, if these signs of aggravation are ignored, they can go on to cause further disorders, such as low sperm count, which can be a result of depletion or weakness in the Shukra Dhatu, often due to a vata or pitta imbalance. Absence of sperm in the semen, which can be due to a kapha and vata imbalance leading to obstruction or failure in sperm production or ejaculation. Sexual dysfunction can be due to an aggravation in all three doshas, but primarily caused by a vata imbalance, which disrupts the normal flow of blood and prana, which is life energy, to the reproductive organs. A pitta imbalance can cause premature ejaculation, and a kapha imbalance can lead to heaviness and a lack of arousal. Infertility can be due to an aggravation in all three doshas. For example, vata can cause fragmentation of shukra, leading to infertility or weak sperm. Pitta aggravation may lead to inflammation, burning sensations, or infections in the reproductive organs, and a kapha aggravation can result in excessive, thick, or sticky shukra, leading to blockages or low motility of sperm. So now let's move on and look at some of the possible causes of aggravation in both Artava and Shukra Vaha Srotas. It could be due to a poor quality diet with foods that are aggravating for your unique constitution, resulting in doshic imbalances. A diet of improper food combinations and ultra-processed foods, which result in the production of poor quality tissues or dhatus. This poor diet and poor eating habits can result in a compromised agni or digestive fire, which can result in accumulation of toxins or ama in the body, which can cause further health problems in the Srotas or channels. Eating and sleeping at irregular times and living out of tune with the circadian rhythm. Suppression or overindulgence in sex. Suppression of natural urges like urination, bowel movements, and so on can disturb the flow of the vata dosha. A sedentary lifestyle can aggravate the kapha dosha, or on the other end of the spectrum, excessive exercise can aggravate both the vata and pitta doshas and can result in a lot of stress in the body. And also emotional stress and worry can be a cause of aggravation in these channels. Hormonal imbalances, sexually transmitted diseases, medications and substance abuse, and trauma, injury, or genetic factors. Now, the Ayurvedic approach to managing Artava and Shukra Vaha Srotas disorders is a holistic approach. And as we can see, these imbalances and disorders can result due to an aggravation in any of the three doshas, which can affect the health of the reproductive tissues, the fluids, and overall vitality. Ayurveda offers a holistic approach to addressing these imbalances through dietary modification, lifestyle changes, cleansing the body, managing stress, and the use of specific Ayurvedic herbs that nourish and strengthen the reproductive tissues and channels, ultimately supporting reproductive health and overall well-being. Of course, this holistic approach needs to be tailored to each individual's current health status and lifestyle. So that's really important. But of course, the best course of action is prevention. And here are some general tips to prevent any imbalances or disorders in the reproductive channels. It's really important to learn about your unique constitution or your body-mind type and understand how to eat, live, and exercise to maintain optimal health. Learning about your subtle signs of imbalance, so you're catching any aggravation in the early stages, and learning how to pacify these imbalances through diet and lifestyle before they manifest into bigger problems. Living in tune with the circadian rhythm for eating, sleeping, and waking in a regular schedule. Respecting your natural urges. Regular exercise that's appropriate for your unique constitution. Making sure you're not overexerting your body or mind and managing stress. Overall, just respecting your body and having quality inputs. And as a result, you will have quality outputs. And if you would like education and support on this journey, then please check out my online services, because in my online consultations, I not only determine your birth constitution if you have a current imbalance, but I also educate you on recognizing those early signs of imbalance and what to do when that happens, so that you feel empowered and confident to take care of your own health and well-being. And I give you a holistic strategy for that, along with addressing any current imbalances. Then I also have my Digestive Reset Cleanse, which is an individually tailored holistic cleanse program to help you reset your physical and mental health. And then if you'd like to study by yourself, I have my 28-day online daily habits for holistic health program. And this is where I help to educate you on living in tune with the circadian rhythm and a more detailed education on how to become your own healer. I also combine all these services, consultations, cleanse, and the daily habits program in my Reset, Restore, Renew program. That's a lot of information. So I'm going to put a link to my website, elementshealingandwellbeing.com, in the show notes. And there I do have a comparison chart where you can compare these programs. And if you'd like to chat before you book anything, then take advantage of my free 15-minute online Services Enquiry Call. We can hop on Zoom and I can answer all of your questions. So I hope you found this episode helpful. And if you know anyone out there, I know there's a lot of people dealing with fertility issues or menstrual cycle disorders, please share this information with them, as Ayurveda has a lot of answers to these imbalances and disorders. And if you feel you're getting benefit from this podcast, I would appreciate a rating and review wherever you listen to your podcast. And if you haven't already subscribed or followed the podcast, please do so, and the new episodes will automatically download. Come join me on social media. My new Instagram page is the Elements of Ayurveda podcast. And on Facebook, it's Elements Healing and Wellbeing. Thank you so much for tuning in. And until next time, take good care of yourself, be well, and bye for now. Slán go fóill.